I'm Dr. Hong Chen Xiong from Massachusetts General Hospital, working in the Chelsea Community Health Center. Today, it's a pleasure again to be back here with you in the Community Health Education TV show with the Chelsea Cable TV and working with the Community Health Improvement Department of Mass General. Today, we have the pleasure to have again a group from Mass General Chelsea Healthcare Center to talk about diabetes and how can we control it, what you can do for it, and also what we can all together do to improve the diabetes care. First of all, I want to introduce our wonderful panel here. We have here Joseph Vicente again, the community health worker in Mass General Chelsea, also medical interpreter, and who is going to serve as representative and have collected a couple of questions from the community about diabetes. Then we have again our star dietitian, Jennifer Vitry, registered dietitian from Medical Specialties of Mass General Chelsea, who is going to give us very useful and important information about nutrition in diabetes. And then we have also Karen Mejia, welcome Karen, that is going to discuss how the Mass General Chelsea can help you through the Department of Community Health Workers and all the amazing things and well-rounded things that they do to help you to control your diabetes. Now, hi.
Thank you.
Pep.
Thank you, and welcome everybody to the show. Today we're very excited about the topic, which is diabetes. So the first question is for Dr. Chen. So what is diabetes?
Good question. What is diabetes? So diabetes is a chronic condition. What does chronic mean? That means that it's going to last the whole life. But also at the same time, it means that we are able to control it if we live healthy, and we are able to control diabetes, so we can live with diabetes as well as any person that is healthy in the community. Usually, having diabetes means that our body will need help to control the sugar in our body. It means that our body has some lack of ability to use and to control well the sugar. And usually, it is based on a hormone that we call insulin. This hormone helps us and help the body to regulate the sugar inside our body. So with that, we have heard a lot that there's two types of diabetes. Diabetes type 1, which usually people think that is from that we get it in young people, the youth, which is more insulin dependent, and the diabetes type 2 that most of the people, when they grow older, they get it. So diabetes type 1 is when our body does not produce efficiently the hormone insulin. What it means that then we will, from young, we will not be able to use the sugar that we eat and then distribute it throughout the body to be used well. And if the blood contains too much sugar for a long time, it can produce some of the consequences of damage. And then diabetes type 2 is what is more common now, and usually is more in older people, and usually the problem there is not that we don't have enough insulin. Sometimes it's more that like our body cannot obey well the orders that the insulin gives to be able to control the sugar. So in obese patients, in older patients, and in people that have a lot of stress, they cannot handle well the sugar because their insulin become resistant. But more and more now, unfortunately, we're seeing obesity in youth people. So diabetes type 2 can also happen in young people. Of this, one of the most important things that we need to think of is the control of sugar. So it's not that like once we have diabetes, we're sentenced, but more like how we can help the body to control the sugar.
So who gets diabetes?
That is a very good question. I think that a lot of people in the community will say like, don't eat too much sugar. When you eat too much sugar, you get diabetes. So actually, if you eat too much of protein, also you can get diabetes. If you eat too much of anything, in the sense of you have too much calories, that will make our body to store a lot and then start causing some disturbance in the hormones. And then that will increase our risk of getting diabetes. So let's go back to diabetes type 1. We don't know exactly what causes diabetes type 1 in the youth. What we know that there is some immune, that means defense mechanism in the body that can actually kill some of the cells that produce the insulin, and therefore we don't have enough insulin to help the body to control the sugar. Now the type 2, as we mentioned before, people that has more that has obesity, that has older age, that has family history, that are sedentary, that means that they do not have enough exercise, also are at higher risk. Some of the ethnic or racial communities, for example, Asians, Hispanics overall, and African Americans are more affected also by diabetes. And then for women, women that get pregnant, during their pregnancy, if they are not able to handle well their sugar, and they always get tested for that, they also later on after delivery, if they get resolved the problem of sugar, later in their life, they also are at a higher risk of having diabetes.
I see. The next question is for you, Jennifer. Hello. Why is so important for patients with diabetes to understand the role of nutrition in diabetes self-care?
Well, nutrition has a very important role in diabetes self-care. The foods that we eat, they fuel our body, but more importantly, we want to choose the best type of fuels. By choosing the best type of fuel, it can help maintain stable energy levels. It can help keep us healthy. Oftentimes, people with diabetes feel that they have to stop eating foods that they enjoy, and that is not true. You can still eat everything that you enjoy, but you will need to be more careful with your portion sizes. Good nutrition, it can help patients with diabetes feel better, improve their overall blood sugar control, and prevent other medical problems that are associated with uncontrolled diabetes. What we eat, how much we eat, and when we eat will have the biggest impact on our overall blood sugar control.
I see. The next question is for you, Dr. Chen. How serious is diabetes?
How serious diabetes is as serious as our life. That's how we manage our life. I think that would be the thing, as Jennifer saying, like we have to eat every day, and that means that we have to take care of our eating every day to control our diabetes. But then it's not as hard. It's like as any healthy people, we have to handle how we eat daily. So what I want to mention is that the most important thing of diabetes is self-management. Does not depend only on going and taking the medicine. It is important, but even before that is how we manage life. So it is serious in the sense, as we mentioned, it's chronic. It will last the whole life. But at the same time, we have the ability to control diabetes, control the sugar. And not only we can do it only, like we don't always do it by ourselves. As many things in life, we need a team. And that's how like the healthcare system or your healthcare team can help you to manage the diabetes. When we cannot handle the diabetes in the sense of like controlling the sugar, what happens is that there's a lot of sugar that stay in the blood. It does not get distributed in the energy along our body, the different tissues or the different organs. For example, the brain, the eye, the heart, the kidney, etc. When that happens, that start causing little damages. The first damage that usually happens is because the sugar stay in the blood, and it will start breaking up the blood vessels. So the first blood vessels that get damaged are the weakest one, the smallest one, and the smallest one is the one that go in deeper to like the brain, the eye, the heart, kidney, etc. So we will, in long term, if we don't control the sugar, they don't get into the different tissue to be used efficiently. When they stay outside, start damaging, then we will start having complications such as stroke from the brain. We will have like vision problem, we will damage our eyes, and we can have more heart attack, cardiovascular disease, what we call heart attacks and heart diseases, heart failure, etc. And also then we can have damage in our kidneys, that we start having failure, and there's a lot of complication going into dialysis. What are the symptoms? Sometimes usually it comes from all this, because It's not that we have too much sugar in our body as a total, but in the blood, they stay in the blood. Our body cannot use it, so we will feel very tired and then we will crave for more food, that we become hungry. We can also, because the sugar stay in the blood and it goes straight out in the urine and it draw water out, we get dehydrated, so we get very thirsty. We can have either weight loss or weight gain. Weight loss that we look really, that we're losing a lot of nutrients, or we deposit all that into fat instead of using it. So we get a lot of weight gain. Because of these different discomfort and damage, we get irritable, so we get mood changes also. We cannot have active, we don't feel that we're capable of being as active as we can. We don't see well, as I was saying. Also, then we start having nerve damages, and then we will start having like some tinglings and pain that usually is chronic, and we can't find the cause of the pain. It's hard to treat. And also, when we get caught, our immune system or our defense system get blocked, that we can't heal our wounds very easily. We start bleeding longer, or we get infection easier. We get more cold, we get more yeast infection, etc. That would indicate that like it's getting some complication for the diabetes.
I see. Back to Jennifer now for the next question, which is a very popular question that we get very often. What foods are best for a diabetes patient to eat?
I think that what we call whole, simple, or unprocessed foods are really best for people who have diabetes, and really all of us. People who have diabetes should really focus on choosing a variety of foods with small, frequent, and balanced meals. A balanced meal ideally will have a source of a carbohydrate or a grain. It'll have a lean protein like chicken or fish, and it should hopefully have a big portion of vegetables. With carbohydrates, they are basically a fancy word for sugar. And our bodies need carbohydrates, but with diabetes, we just don't want to have too much of a carbohydrate at one time, or it can result in an elevated blood sugar. Foods that have carbohydrates or grains, like bread and pasta and rice, also starchy vegetables like potatoes and corn and plantain and yuca, certain dairy products like milk and yogurt and ice cream, beans, and many more foods. So the key is really to control the portion of carbohydrates, and also we want to balance the meals. And also it's best to choose what we call whole grains. Whole grains, for example, are foods like oatmeal or brown rice or 100% whole grain bread, because they have more fiber. And when we eat more fiber, we tend to feel fuller longer, and it can have a better impact on helping us to control our blood sugars. The key, though, is still to control your portions, because oftentimes we'll have people come in to see us and they might be eating brown rice and they think it's better, but they're still having a huge portion, and they don't understand why their blood sugars are high. So really it's all about portion control. And as far as fats, we also want to choose healthy fats. So fats, for instance, from avocados or fish, nuts, olive oil, and we want to limit the animal fats in our diet.
I see. And conversely, what foods should a diabetes patient avoid?
So there are technically no foods that a patient with diabetes needs to avoid completely. It's all about balance. We do want to avoid drinks that are sugar sweetened, so really no soda, no fruit juices, and no energy drinks. We also want to limit foods that are really concentrated in sugar, like candy, and again, soda and sweets, because they really provide very little nutritional value and can often cause a really rapid or quick increase in our blood sugar. And we also want to be careful with the types of sugar we have. Oftentimes people will ask us about brown sugar or honey, again, thinking it's a healthier option, but our bodies really digest all forms of sugar the same way, so it's important to limit every type of sugar. Sugar substitutes are considered safe in moderation if you choose to use them. And generally, it's a good idea for all of us to limit salt in our diets as well.
So how many diabetes patients MGH sees Dr. Chen?
A lot in the community. I do want to piggyback a little bit of what Jennifer said. I think that a lot of patients come in and say that I don't eat the whole day. I literally don't eat. But then they are drinking, which people, I think in the past we have considered that fruit juice is smart, it's very healthy. So we get a lot of fruit juice, and like more and more recent data show that fruit juice actually increase sugar still. So it's not about only what you chew, but also what you put into your mouth. What you drink also have affected a lot in our patient population. And going back on how much patients in Mass General were working on getting the data, and Mass General is doing a lot of work in how to understand better diabetes and the number in getting how to help better our patients. But in Massachusetts in general, and as we know in Chelsea, is that diabetes is more prevalent in Hispanic and in African American. It's more than about 12% compared with white people. It's like about 9% in Massachusetts. And not only that, the prevalence, like having diabetes, is more in Hispanic and African American. Also, the outcome of health, like by having diabetes in general, people with Hispanic people and African American people having the same diabetes condition has worse outcome, like dying more from heart attack, dying more from like dialysis and those complications. So it's very important to kind of like control not only with this saying that like, oh, I have diabetes is the same, but also like understanding that like in this population, having the same condition can lead to worse outcomes.
Sí, hello Karen. These days there is lots of excitement about community work. So I want to start with a question for you. What is a community health worker? Can you please tell us?
Yeah, so basically community health workers are, someone who works in the community, but it's basically someone who's a bridge between the patients and the providers. Someone who can understand their challenges, and most of the time they come with those understandings from their own past experience. And so community health workers are there to guide patients, navigate them to either the health systems or whatever they're going through. It doesn't matter if it's with their, insurance or with the medical or housing or anything, but community health workers are there to help them with it culturally or linguistically with patients.
See, so what does a community health worker do to that makes a difference in patient care and community health?
Well, the difference is that we are in the health center, but we also are in the community. So we do home visits. We all often get the patients where they are. And so we get to know where the barriers are and help them to at least not fix them, but at least encourage them to which way to take. And so we help them, with their health insurance when it needs to, and we embrace the Determinant Health. The patient Determinants of Health, which includes what is going on with them. Housing, employment, everything, immigration, insurance, so everything that is going on, childcare for their kids. So we sometimes are working with an adult, but they have children, and so if they don't have, if they need care, they need childcare, and that's what they need, the help. Sometimes providers want them to come to their appointments, but if there's no childcare, how they're going to come to their appointments? So that's where community health workers come and help in getting them to childcare, or for instance, if they don't have insurance, or the insurance is limited and they have one type of insurance that only covers medicine in the pharmacy from the hospital, then we navigate them where to take that medicine. So we basically know the community, so we can connect patients in the community, and we basically know the health center, so we can also connect patients in the health center.
I see. And Dr. Chen, you also mentioned social determinants of health at the beginning of the show. Can you please explain a bit more? What are some of the challenges or social determinants of health a patient can face in diabetes self-care at home and in the community?
Great, thank you, Karen. I think that like a community health worker is much more important than any doctor that our patients can have, because they literally not only serve as helper, but they also serve as advocates to create more resources for the community. So as a definition, we have been discussing about social determinants of health, and it is defined by the World Health Organization as the condition in which we're born, grow, live, learn, play, work, worship, and age. That means everything in life, as like Karen has mentioned. There's issues as like food, transportation, education, childcare, job conditions, finance, housing, and safety issues. So we know that like has been enormous amount of research both in the past and now in the present, and I'm sure the more coming up, how our social conditions affect our health outcome. We know that actually clinical care only helps 10%, and social condition actually costs 90% of the disturbances in our health. So the fact that, for example, we have the so food insecurity, for example, is one of the social determinants, the oldest that has been studied in our community. We have found that like 10 years ago, 2009, people with food insecurity, and we follow them through, they have gained more weight. What is food insecurity is like not having a reliable source of food that is nutritious and culturally appropriate. And how people would say, how can lack of food make you gain more weight? So that is what we can intervene, all the social determinants of health. For example, food insecure patients might have also housing insecurity, that now is one of the most serious problems in our community and raised by our patients. Not having a stable place to live means that we can't get food that we can prepare a healthy meal. We can't have a space where we can store our medication and be able to eat, peacefully, or actually to take our medication in a timely manner. At the same time, also that not having a house, a reliable shelter that we can live means that we can't sleep well, and sleeping is one of the stages that our body self-heal in the best way. So not sleeping by itself make our body to have increased risk of having diseases any type, including diabetes, heart attack, high blood pressure, infection, etc. Also, not having a secure housing means that we are starting to have like lack of family support or having a good network of friends. Nowadays, there's a lot of youth, unfortunately, that has to go through couch surfing, the term, that like go, and even families that go from one place to another but not steadily, that make them to have more mental health issues, make them then have all the priority than their own health, and they start having difficulties and lack of resource to take care of their own health. And as simple as also then other things like job insecurity, if we don't have a time to rest, we don't have a good meal, then that would make us not capable of finding a good job, and that would further kind of like go in detriment of our incomes, not having enough income to be able to afford medication, to be able to get health insurance. So as simple as like diabetes, not being able to eat healthy, as like Jennifer is advising, then not being able to sleep well, not being able to take their medication, not being able to have transportation and go to the appointment with the doctor as many patients want, but cannot be able to do, that always lead like them from one small thing like controlling the sugar to a full array of all the conditions that we cannot say. So again, I want to highlight the importance of like having a community health worker. They're not only bridges, but they are your advocates to help to create resources, to connect resources, and also to advocate for, to be able that the healthcare system can understand better what are the needs of our patient. And the best treatment for diabetes might not be the insulin that you get from the medication, but somebody can help you to live more richly and to be able to access your resources and contribute to the community more efficiently.
Sí. Back to you, Jennifer, for this question. So how can a patient work with a registered dietitian in diabetes management? What are the benefits?
At Mass General, we have a team of registered dietitians who you can meet with, who can help you learn more about how to follow a healthy diet for diabetes, or really any other medical nutrition related problem. What I think specifically makes a dietitian more beneficial is that we have years of education and training specifically in medical nutrition, and we can help you come up with an individual plan that's based for you on your individual medical problems. And there's different ways that you can go about getting a referral to see a dietitian. Your doctor might automatically refer you to see one of us, or you can ask if you have specific nutrition-related concerns for a referral.
I see. The next question is a very open question that I think that pertains to the three of you. So if a patient has trouble getting healthy food, where can the patient go to get help?
I think first, the patient should not feel embarrassed. It's a very common struggle, especially in our community. We are all here to help our patients. I would feel comfortable saying to any provider that you have an appointment with that you're struggling at home. And then we have the resources at MGH and in the Chelsea community to tell you what's available to help you, whether it be our local food pantries, our food pantry specifically within MGH Chelsea, other local services. Our dietitians will work with you on really recommending foods that are affordable, which we try to focus on all the time. Anyways, there's a big misconception that people think to be healthy and to eat well, they have to spend more money, which isn't true. And I think Karen can tell us specifically what services we have at MGH Chelsea.
So yes, at MGH Chelsea we have a Food for Family program, it's called. It's a food pantry that right now is running a full capacity for a lot of patients. So the way this work is, they go through a referral system where the provider can refer them to the Food for Family program. But if someone is in need on the same day, we can also provide for as an emergency at the same day, you know. But we also, community health workers, you know, we have a list of places where patients can go, and we can navigate them to get their food as well, and connect them not only in Chelsea but in the cities nearby, and even if they, you know, live in Boston, wherever it is, we try to connect them in the food pantries there as well.
Yeah, I want to mention that, like as Jennifer and Karen says, like don't feel embarrassed, because unfortunately it's a very common problem in our community. And I think it's the false conception that people think that expensive food are healthier, and that's not true. Actually, now we have several pantries, and Karen would be able to refer patients to these different organizations, and many churches is offering now, as well as there's this organization called the Hunger Network, which many agencies in our community, including Mass General, collaborate to bring the best food for the community. And don't feel that food pantry are not nutritious food. Actually, they get the dietitian input for the type of food they serve. This has a great variety of fruits and vegetables, and even canned goods, like canned fruits and vegetables. There's of course some palate issue on it, but some has still the fibers and the vitamin that we need. So like food pantry food are healthy food also, and it's about talking with your dietitian to how to work on it, and they are the best to know how to kind of adjust and personalize your meal plan. There's even also in our community many places that offer hot meals for breakfast and lunch for now, and the Hunger Network are working with the community, and we need more people to come in and give input to probably create even more resources in that aspect. So please go to the local food pantry, ask your different pastoral services, different faith, even like there's a faith alliance that they would be able to get you resources, and of course the Food for Family program in our community can provide you the resources of the food, and then they are very healthy sources of food.
Thank you. So Karen, how can a community health worker help diabetes patients in receiving care and disease management at MGH Chelsea?
So the way we help them is basically, like I said before, we meet the patients where they are. We help them, connect them with their insurance, depending on their insurance. A lot of our patients don't have insurance, or the insurance system is really complicated. They already are facing what diabetes is. They're really new, some of them, with this new diagnosis, and they don't understand. Sometimes we have to sit down with them again and re-explain what the doctor have said. We accompany them to their visits. We keep on telling them that they need to go to the nutritionist, even though we sit down and after they visit the nutritionist and we go over what they have talked with the nutritionist. But we also, if they need the food pantry as well, we go over when to get their food. And we reinforce what they have already heard from the provider, from the nutritionist, and we connect them. Like for instance, if it's housing, patients with diabetes, if they don't have where to stay, where to live, like the doctor said, how they're going to take care of their diabetes. So we are connecting them with the housing specialist, helping them filling out their applications for housing, or if they need jobs, we also connecting them with the places where they can be training for them for jobs. So we are there to help them connect with any barriers that they're facing, and making sure that they can surpass that barrier and address the issues that are for them complicated, but also reinforce what the nutritionists and the doctors are saying that they need to follow.
I see. So after all that you said, all of you, this is again a very open question. So how does MGH Chelsea look for new ways to better serve diabetes patients?
So right now, the MGH Chelsea is going to have a pilot program where community health workers are going to be working specifically only with diabetes patients. And this is for, like I said, to work very closely with the diabetes nurses, and being able to go to those appointments, being able to reinforce what is they're being telling the patients, but also connecting them with the resources that are in the community, and helping them understand their disease. And Chelsea is a community that is always changing culturally, right? And so right now we have a lot of new culturally that or new people that are coming that sometimes they don't really understand what is the food like. They feel that they can eat this food because it's better for them, or because they never had it in the past. But if they can connect, or basically they never went to the doctor back in their country. But if community health workers are there to understand them and to connect them to the nutritionists, to the doctors, but also explain to them that there's a new system, a better system, a system that they can help them with the disease. I think this will be a way to help with the team, everyone as a team, for a patient.
Good. All right. Thank you very much. And I think that was a very thorough and enlightening conversation. So I would like to hear some final words from you about this topic. From you all, yeah.
I can start. I think that more than, as you see here, is remember that your care team is not only the physician, and that we can provide care much more beyond of one physician can do, and we see how important is the community health worker, how important is the dietitian. Just highlight and put your mind that like for everything, actually a team approach is the best. So you can entry to care in any of these aspects. First of all, the community care, then bridging with the community health worker to the healthcare system, dietitian and physicians. And everyone is very important as to connect the patient and help the patient. And the patient should feel comfortable to open up to any of these members of the team, and we will work together to provide the care that they need. As a plug-in also for, like we discussed about social determinants of health, how those are actually the opportunities for the patient to actually to maintain health and not to only address disease when they come, but much before we go in to see a doctor, we have the opportunity to build our own health and maintain our healthy body is what we have in the start. And how to build that, the different shows that we have had air about the resources in our community. We had a show about food insecurity from different representatives of the food pantries, of housing insecurity, also for job insecurity, the different agencies that can help for job training and help you to find job opportunities, also for childcare and early education for our children. So please consider this teamwork of you have a whole army that can help you, but also you are the most important driver of care. The patient is the one that will come in and help us to access new ways and understand better and get new research questions to go on to be able to understand better ways of how we can help as community members. And I really appreciate the nutritional input that Jennifer always gives us, and to be simple. And I think that like she has repetitive said the word about being balanced. There's no completely off limit things. It's about enjoyment. It's not about excess, and portion control, how important it is, and then how like social workers can be your, if you don't remember of anything else about this show, remember there's a community health worker. Community means that they are with you, they are your ally, and they work not for the doctor but for you to be able to get the things that you need from any healthcare system. Jennifer and
well said. I mean, we truly are a team, and I think everyone at MGH Chelsea works together to help all of our patients. From the nutrition standpoint, I just want to reiterate or say again how important diet is. But if you've had diabetes for a long time, or even if you're newly diagnosed, please don't worry, don't feel like you have to change your eating habits completely. Little changes that you can stick with will have the longest impact on your health and helping to control your diabetes. And again, we're here to help you. We want to teach you more about nutrition, and we want to help you have a healthy lifestyle.
I agree with everything that I have said, but I wanted to say that diabetes is a community community problem. I really believe that. And because it's a community problem, it's everyone's job to make it better for our community, especially for the new generation. And so I think that as a community health worker, we, in talking, on behalf of the community health workers and all my colleagues, I think we wanted to be here to help our patients the best way possible, knowing that we sometimes go through those experiences ourselves and understand what they go through. And so we're here to help in any way possible. We go above and beyond for whatever we need to do to help you.
Great conversation. Thank you, Karen. Thank you, Jennifer. Thank you, Dr. Chen. And now back to you for your concluding remarks.
Thank you again for your attention, and thank you again for the inputs that you have given us to drive this show. Please remember that we're here to help, and we're also here to learn from you. So please bring up your concern, bring up your suggestion, and also bring up your energy to help us also. Please do stay for the slides that will come after the show that will give you some of the links and resources on where you can learn about more information. Thank you again and have a good day.